वहां से कर सकते हैं और मैं यहाँ से। Good afternoon, everyone. Am I audible to you all?
Yes, sir.
Thank you. On behalf of WHO FCTC Knowledge Hub on Smokeless Tobacco team, I would like to welcome you all to the inaugural webinar of TOCOIndia TOCO, a monthly online lecture series on tobacco control in India. I am Dr. Prashant Kumar Singh. I work here as a scientist D and also nodal officer of the WHO FCTC Knowledge Hub on Smokeless Tobacco. The main aim of this TOCOIndia TOCO initiative is to share and disseminate recent advances in tobacco control efforts in the country, including epidemiology, policy, advocacy, and tobacco cessation. Through this lecture, what we aim is to encourage young researchers and tobacco control advocates to participate in tobacco control efforts in India. There are few housekeeping things which I would like to highlight at this stage. One is that please, we would highly request you to mute yourself throughout the lecture, and any question or the queries, if you have, just put it into the chat box, and our eminent speaker will take up the questions at the end of the session. For this inaugural lecture, it is our immense pleasure to invite Dr. Shalini Singh, Director, ICMR-National and WHO FCTC Knowledge Hub on Smokeless Tobacco. I would read a brief bio of ma'am for those who have actually joined us for the first time. Dr. Shalini Singh is a clinical and a researcher with nearly 35 years of work experience. She is a member of National Academy of Medical Sciences and fellow of ICOG. She worked in various settings, including medical college, providing clinical services, undergraduate and postgraduate teaching, and as a researcher and research administrator at the Indian Council of Medical Research in New Delhi. She has trained in bioethics and has extensive experience in conceptualizing, designing, and coordinating public health research across India. Her current areas of work include capacity building of different cadres of healthcare providers for screening of oral, breast, and cervical cancers, prevention of non-communicable diseases, including cancer, and research on smokeless tobacco. Under her able leadership, ICMR-National established one of the largest COVID-19 testing centers in Delhi NCR during the lockdown in a record time, and executed various studies pertaining to the COVID-19. Ma'am, no, it's over to you.
Thank you, Dr. Prashant, and good afternoon, everyone. I welcome you to attend this lecture series on tobacco control. These are our small efforts towards controlling the tobacco epidemic in the country. And we hope that you will be with us throughout these lecture series. So this is just the overview of tobacco control efforts that we are doing at ICMR and ICPR. And in this lecture, I will be telling you about what is WHO FCTC, what is the WHO FCTC Knowledge Hub on Smokeless Tobacco, what is the smokeless tobacco burden in our country and globally, and also what are the activities of the Knowledge Hub of smokeless tobacco. So this is just an overview so that you are able to understand what kind of activities we do, and in various ways you can also contribute. So coming to what is WHO FCTC, WHO, the World Health Organization Framework Convention on Tobacco Control, is a global public health treaty. And this treaty, through this treaty, it affirms the right of all people to the highest standards of health. Now, everyone knows that tobacco is a big cause of ill health globally and in our country as well. And so in response to this, the countries joined hands together and they signed up for this treaty. So this treaty aims to tackle some of the causes of the tobacco epidemic. And since tobacco has a lot of cross-border effects, like they are being imported or exported because of trade liberalization, and there's direct foreign investment in these products. There is tobacco advertising, promotion, and sponsorship, which is goes beyond the national borders. And there is also illicit trade in tobacco products. So to address all these things, a lot of countries have joined this treaty. And this treaty was first time it came into force in 2005, and India also accepted this this treaty. And currently there are 182 countries, as we call them, parties to the convention. So the Conference of the Parties, COP, is the governing body of the WHO FCTC, and it maintains a record of the global progress reports in the tobacco control, and also it identifies the areas in which more progress needs to be made by the parties. So it's a written document, the convention, and it has several parts to it. And like part 1 contains the introduction, part 2, 3, 4, 5 are mostly concerned, with the obligations of the countries or the parties. And these are the mostly which we use and take guidance from in the day-to-day functioning. And then there are other parts which are related to the scientific and technical cooperation, and then institutional arrangements, how to settle the disputes, etc. The protocol to eliminate illicit trade in tobacco products has been built on Article 15, and it's a separate document. And then there are guidelines for the key provisions of the WHO FCTC. So the WHO FCTC has also given a global strategy to control tobacco. And this strategy is from 2019 to 2025, because it envisions a tobacco-free world. And the mission of this strategy is to present and protect the present and the future generations from the devastating effects of tobacco on health, social and environment, economic consequences of tobacco, and also it helps to promote the exposure through tobacco smoke because of the timely implementation of the WHO FCTC. So its overall global target is a 30% relative reduction in the age standardized prevalence of current tobacco use in persons aged 15 years or more by 2025. So these are the various documents which bring out the strategic goals and how to execute them by the countries. Coming to the knowledge hubs. So to be able to analyze, synthesize, and disseminate information to the parties, the Secretariat established 8 knowledge hubs. At least there is 1 knowledge hub in each of the WHO regions. And the knowledge hubs generally they go beyond their scope of work nationally. They go globally. They help other countries in achieving tobacco control. And the first knowledge hub was operationalized in Australia in 2014. And the most recent one is in Brazil in 2020. So this slide shows you where all these 8 knowledge hubs are in the world. And in India, at our institute, we have the knowledge hub on smokeless tobacco. And all these hubs are either located in the academic institutions or in government organizations, except the one in Australia, which was established the first. It is affiliated to an NGO. Coming to the knowledge hub on smokeless tobacco, some information about this. It was established in our institute in 2016, and its main objective was to assist the parties in improving smokeless tobacco control in consultation with the Secretariat. And so the knowledge hub, it collects and generates evidence on different aspects of smokeless tobacco to inform the policy for control of smokeless tobacco. So these are the various areas which you can see: policy reform, products, what are the health effects of smokeless tobacco, what are the economics and marketing strategies, and what are the interventions that we can do to control smokeless tobacco. So these are the mainly areas in which the hub team works. This is the website of the Knowledge Hub, and anybody can access it, and we routinely update it. Now, let us talk a little about the burden of smokeless tobacco. So then you will realize why a separate knowledge hub is required in the first place for smokeless tobacco. So, you know, smokeless tobacco is a huge problem globally, but especially in the Southeast Asia region, where you can see in the blue, you can see the prevalence of smokeless tobacco use amongst males, and in the red, you can see the smokeless tobacco use in the females. These are millions of users. How many million users there are there? In the in total, there are 248 million users of smokeless tobacco products, SLT as we call them. And countries with a high prevalence of smokeless tobacco include India, Bangladesh, Egypt, Nigeria, and the Philippines. So here you can see the distribution of smokeless tobacco use amongst adult males in the red area shows that the prevalence is about 25 to 40%. And India, as you can see, is in the red color. And the blue ones, the dark blue is actually 0 to less than 2%. And in the females also, India is one of the highest burden, and you can see Bangladesh is in red. So we'll talk a little bit about what is the status of tobacco epidemic in the country. So we have the Global Adult Tobacco Survey, GATS, as it is called, GATS. So the 2016 is the most recent GATS. And here you can see that nearly 30% of the population consumes some form of tobacco or the other. In the blue, you can see the smokers, which is like 7%. And in the green, you can see the smokeless tobacco users, that is 18%. And the red shows that these 4% people use both smokeless tobacco as well as they smoke, whereas 71%, the purple, are non-users. So in total, we have a burden of nearly 30 crore of tobacco users in our country. And in our country, smoking is like 1/3 of the population smokes, while 2/3 of the tobacco users use smokeless tobacco. And in the pie chart below, you can see the distribution amongst men and the women. So in women, smokeless tobacco is mostly more popular, whereas in men, there's some bit of smoking also. So only 6% of women use tobacco in the smoking form, whereas 94% go in for smokeless tobacco use. So this is the kind of burden which we have in our country. Now, this data also indicates that 1 in 5 Indians use these products, and the age of initiation of smokeless tobacco products is really very low, that nearly 52% of the users have initiated the use at 10 years or below. And in these two graphs, you can see the distribution of smokeless tobacco use by gender and by residence. So in the blue, you can see the urban people, and in the red, you can see the rural population. So both in the rural as well as in the urban, you can see the smokeless tobacco is very high. Now, the distribution of the different age groups, so in the 15 to 24 years of age group, 14% of men are using smokeless tobacco, whereas only 3.6% of the women are using this. But as the age advances, they have come, hand in hand, and like nearly 1/4 of the population is using these products. Here is a distribution which shows the use in various states. And you can see that the northeast part of our country has the highest prevalence of smokeless tobacco use. And whereas in the Himachal Pradesh, it is minimal. Now, coming to the use of smokeless tobacco by pregnant women, again, the Northeast has a very high rate of pregnant women using smokeless tobacco, though you can see on the side that it has various adverse effects on pregnancy as well. I've already mentioned that very young people, children less than 10 years of age have started using smokeless tobacco products. And here you can see the Global Youth Tobacco Survey, which is called the GYTS. The fourth survey was done in 2019, and a total of 12.5% ever smokeless tobacco users were seen to be there. Though the current tobacco users is given in red, and the ever users of pan masala together with tobacco is shown in the green color. So you can see the distribution in the urban areas, rural areas, amongst the boys and amongst the girls. Finally, coming to the objectives of the Knowledge Hub on smokeless tobacco. So the four broad categories are to generate knowledge, to disseminate information, to build capacity of tobacco control advocates, as well as provide information for policy changes and support the WHO FCTC Secretariat in its mission. So on our website, you can see the various smokeless tobacco products which are listed, and it includes a huge variety of non-combustible tobacco products that can be used either orally or nasally. And so you may not have seen actually all these products, because each geographic region or each cultural region has its own different kind of a product. So in our institute, various studies are ongoing to identify the microbial characteristics of these products, as well as changes in the oral microbiome of the users. So these products have been well described on our website. So what do we do to help policy? We publish various papers, prepare documents, and inform the government to take decision and on these aspects. So the first ever white paper on smokeless tobacco use and women's health was published in 2020. And this actually explicitly showed what is the burden of smokeless tobacco use amongst pregnant women, because earlier there had never been a systematic review on this aspect. And what we found was that we have two national surveys, the GATS and the NFHS, the National Family Health Survey. But in both the surveys, if we look at in both the surveys, the GATS one is shown in the blue and the red one is the NFHS survey. They've been done almost in very close succession, but there's a huge difference in the prevalence of women who are using smokeless tobacco. So maybe there's some form of methodology or some, but for the researchers, it's something to dwell upon and understand why there are differences, and we'd like to, whatever the prevalence, we'd like to help reduce it. Then we also had this white paper on electronic nicotine delivery systems published, which paved the way for the Prohibition of Electronic Cigarettes Act in 2019. And that's why in our country, e-cigarettes are banned. There are a few other important documents which have been published by the Hub, and this includes the report on the global smokeless tobacco control policies and their implementation. It was published in 2018. Then there was also another comprehensive report on that, on the smokeless tobacco control policies. And there was a special issue on the challenges in control of smokeless tobacco use, published by the Indian Journal of Medical Research. There was a whole special issue. And so you can find a lot of important papers here. So during COVID-19, the Hub actually designed and drafted that spitting of saliva following the use of smokeless tobacco can be a huge problem in the spread of pandemic. And so the government of India, it banned spitting in public places, and a lot of states actually then replicated the ban in their states. So this is one important assistance to the policy which the Hub gave. Further, the COTPA amendment bill, that's the tobacco, prohibition of advertisement and regulation of trade and commerce and supply of tobacco is to be amended. And so the Hub actually gave some suggestions to the government for inclusion in the new bill. So these are again some of the policy inputs that the Hub gives. What else has the Hub done in terms of synthesizing evidence? So this study was published in very recently, and in this study, it was it showed that what is the burden of smoking, what is the burden of smokeless tobacco and alcohol across the districts, because earlier the state level burden was available, but this actually showed the sub-national level burden. And this map says it all, that this one is for smoking amongst men and women. And it shows that in 410 districts of the country, 1 in 5 men smoke, whereas in 24 districts, 1 in 10 women smoke. So, but coming to the smokeless tobacco burden among men and women, you can see that in 440 districts, 1 in 5 men choose smokeless tobacco, whereas in 63 districts, 1 in 10 women choose smokeless tobacco. So if you have to actually have some policy or intervention, these are the districts where you should focus your attention on. Further, we have done more work on smokeless tobacco and its effect on reproductive and maternal health, because there are not much papers published on this, and there is not much focus given to the use of smokeless tobacco during pregnancy or lactation. And we did a multicentric study, and to find out, it was a mixed method study. We found out what are the determinants of smokeless tobacco initiation and its continuation during pregnancy and lactation, because most women believe that it is harmful, but still they do not stop using it during pregnancy and lactation. So we understood that it was the initiation was due to perceived benefits, rather misperceived benefits, and to tackle the pregnancy urges and like nausea. And also there was the elderly women in the family actually recommended its use, and it was very inexpensive and easily available and accessible. And those women who were also able to quit during pregnancy had a relapse during the lactation period. So what were the challenges associated with SLT cessation? We felt that the data showed that the front health line workers, they did not have the training to actually recommend cessation to these women. And this was not being asked in the ANC clinics, or no advice was being given to the women. So the whole, I think the whole focus should be focused on the woman to actually be able to understand what are the ill effects of smokeless tobacco use, and also help them quit. So we developed a behavioral change intervention, which was really culturally appropriate and gender inclusive. And we have had good success in cessation during pregnancy and lactation. So this was a scoping, this was a secondary data analysis of, what is the kind of burden in the low and middle income countries. So these all these showed that in the Southeast Asia region, during pregnancy as well as during breastfeeding, there's a high burden, and in fact in breastfeeding it is much higher than smoking. So we have to really pay attention to these. And if you look at the Indian scenario, you can again see that the northeast part of the country has a really high burden. So we are actually doing study in the district hospital in Gautam Budh Nagar to integrate cessation services in the routine antenatal care. Now, few people would understand what is the link of smokeless tobacco with public health nutrition. So we did a systematic review, the first of its kind, and we found that there was not much papers published in this regard. And it was seen that smokeless tobacco use has a huge deleterious effect on body weight. It alters the taste, there is poor oral health, and there is no consumption of fruits and vegetables. And maternal use of smokeless tobacco leads to anemia as well as to adverse birth outcomes. It also increases the chances of metabolic syndrome and gallstone disease amongst the users. So this study has also been published last year. We also have done interventions features. We are part of a multi-country study which was initiated by the University of York. And here we examined the impact of behavioral change intervention on smokeless tobacco quitting. And the study had 4 arms, and in one of the arms, we were also giving NRT, that is nicotine replacement therapy. But what we found was that behavioral counseling worked best, and we had a huge success that 50% of our users actually quit. And the follow-up period was also pretty long, which was 26 weeks of follow-up. So these are some videos which the quitters actually we recorded from them, and we have placed it on our website. These are some of the IC materials which we used. Coming to advocacy and training, we are working both at the national and the international level. And we assist, as our mandate is to assist the parties in addressing smokeless tobacco use and development of policies. So we assisted Myanmar, our neighboring country, to draft the policies They already had one, but which was preliminary, didn't include smokeless tobacco. So we analyzed the article-wise gaps and made recommendations for better and quick implementation of certain aspects, like adoption of plain packaging and enforcement of current tobacco law and how to increase its effectiveness and how to raise taxes to reduce affordability. So all these things were suggested, and they actually made a better law amended it. We also had an international meeting on tobacco advertisement, promotion and sponsorship ban on smokeless tobacco, and representatives from Bangladesh, Bhutan, Myanmar, Nepal, and Sri Lanka were invited, and they came. And we also included our state nodal officers and food safety officers of the various states. And this was a highly successful meeting, and a lot of information sharing was done between the countries on how to control smokeless tobacco in the region. Then we also had an implementation meeting in Bihar, Patna, where you can see in the photograph the health minister of Bihar participated, and he shared his first-hand experience of having quit smokeless tobacco. And so various methods and suggestions were given to the state nodal officers, and notifications were released following this to the various in various states, and they went a step ahead to ban smokeless tobacco. Then we also conduct some training courses and with the help of national as well as international experts. And this one was in the year 2020, where the experts highlighted the how youth can be protected from industry manipulation. And this was also released on the World No Tobacco Day. Then another course we did on smokeless tobacco cessation in collaboration with the University of York, where we again had 168 participants from 10 countries to attend the course, and they actually learned how to help in tobacco cessation. So we did a webinar to inform and sensitize the government officials on how to follow the code of conduct for which should be followed, when you're dealing with tobacco industry, and how not to actually engage with tobacco industry. So this was maybe because it has a lot of information. At times the busy government officials actually do not know that how to engage with them, or actually draw lines, where to draw lines. So these kind of information were very useful for the participants. We also do a lot of public outreach on various occasions, and this was one occasion where the articles suggested that tobacco is actually helpful in COVID-19 disease. So we had to break and bust the myth, and we did various webinars explaining to the people how it is very harmful. And during this vulnerable period, we still reached out to the public and the youth, and also to the migrant populations. So we had various camps at bus stations, and where we informed the drivers, the bus conductors, and the staff members about the harms of tobacco use. And we are fortunate to have a postgraduate degree college close to our campus, where we engage with these students and propagate the tobacco cessation feelings amongst the youth. Then finally, tobacco control can only be achieved if everybody joins hand, and there is not much of I would say strength in this area. So we routinely have a lot of trainee students. We encourage trainee students to come to our institute and work on some aspects of tobacco control. And we also encourage postdoctoral students to join us. And these students can be from various disciplines, as it's been mentioned here, like law. They could be medical students, dental surgery students, population studies, sociology, nursing. They could be nutritionists or even economics. So because tobacco is a multi-headed, hydra-headed problem, so we do need a multi-pronged approach and understanding of various things which go around in controlling tobacco. Finally, we also have a national tobacco testing laboratory, which specifically addresses the Article 9 of the WHO FCTC. And this is under the Ministry of Health and Family Welfare, where we test the products given to us by the ministry. And we are thankful to our various partners who have always supported our efforts and provided us inputs. But besides these, which have been listed here, there are individuals also who provide us legal support and advice on how, on various issues of policy. So we are really thankful for their support. And of course, thanks to our nice team who's ever active in the cause of improving public health. So thank you very much for your patient listening.
Thank you, ma'am, for your very elaborative and thought-provoking lecture. And if I have to actually say that at least your lecture has actually make an attempt to raise some awareness about the smokeless tobacco use among the audience who have actually joined today, and what we could actually see the questions, it includes various aspects, including some questions where the participants have actually asked that how they could actually collaborate with us. So this actually itself highlight that we have achieved our first aim of having more information about the smokeless tobacco, so that the individuals and the organizations can actually take up their own individual or the organizational steps. And in doing so, we are happy to actually collaborate with them. So ma'am, to actually pick few of the questions, one questions is about how does the consumption correlate with the tobacco cultivation in states? So the participants would like to know that how the states who are having a higher consumption of the smokeless tobacco, and then if we can hypothesize that the same states are having higher uses pattern as well or not. So this is the question.
So very good question. Actually, tobacco is a cash crop, which means that, one has to grow tobacco and then sell it. It is also exported. So it's possible that because it's so addictive, those people who are engaged in cultivation, it's an occupational exposure for them. And so I think it's worthwhile to get this data and actually let the data speak for itself. But definitely a lot of countries who are actually trying to reduce tobacco use have taken up this aspect and informed their Ministry of Agriculture and agriculturists in the private sector to actually reduce the cultivation of tobacco if they are going to move towards a situation where they have to actually be tobacco free. So that is a strategy which should be used if you are aiming towards a tobacco free nation.
Well, the next question is about how has the Myanmar progressed after India's assistance, and whether we have actually conducted any sort of evaluation of that.
Yeah. So no, we haven't evaluated, because the evaluation is by the country itself. They were able to, it was pre-COVID actually when we assisted them, and they made those laws for plain packaging, which is a very important law. So it remains, it's an ever progressing field. So once a law is made, it takes a very, a little while to be able to implement it in its proper form. But at least the first beginning has been made. So it's naturally up to the ministry to be able to take it through.
Ma'am, the next question is about, are there any studies linking with PCOS and tobacco usage among women?
So, see, PCOS, the polycystic ovarian syndrome, this is endocrine problem, hyperinsulinemia problem, and tobacco itself causes inflammation. So it's likely that because of the hormonal perturbations, because it does affect the diabetes status, and so it remains, I mean, there have been, I don't recollect any studies per se linking the hypothesis or the that it causes directly, but it remains to be seen, because it is an inflammatory product. It causes inflammation, and inflammation in turn can cause various diseases, and it's possible. We have to really see that. We have not explored, and I have not come across studies directly linking PCOS with the use of tobacco.
The next question is about what are the initiatives being actually taken as part of the FCTC or the tobacco control efforts at large at the school level. So 2 or 3 actually questions are at about the school and school centric actions.
Yeah. The government of India is taking initiative for the tobacco-free institutions. There are guidelines on the National Tobacco Control Program's website, how to make your tobacco, how to make institutions and educational institutions, and especially schools, tobacco-free. And, you can't have a tobacco kiosk within 100 yards of the educational institutes. So those are some of the guidelines which are there already. So it is up to the school administration to execute these guidelines and report if there is a violation. So guidelines are already there.
Ma'am, the last question, do we have data on the yearly prevalence of SLT among 10 to 19 years?
The youth survey is the adult global tobacco. So the global adult tobacco survey is done in 15 years and more. And in that, I think we can see this. But the global youth tobacco survey is for children below 15 years. So partly we can get the data from there. So we'll have to join data from both the surveys to be able to get to your answer.
Yeah. And actually, just to add to this, answer is that we unfortunately do not have a yearly prevalence data.
Right.
So it's all about the cross-sectional data which we have at a certain time or period. Like for GYTS1, we have the data for 2009, and then the GYTS2 in 2020. So we actually do not have any sort of yearly prevalence data.
We do not have yearly prevalence.
And ma'am, I haven't asked you a question about the Fagelstone scale, because these are the questions which actually could be answered by experts who are into those
We will
areas.
be dealing with
Yeah, and what I would actually encourage the participants to actually join our future sessions where the experts on the tobacco cessation and how they actually deal with the different scales and all will be actually discussed. So I would actually encourage you to stay tuned to our upcoming seminars, because this is just a brief about that what we are actually doing at our institute, and how much is the problem at the national level as and at the state level, and what are the dimensions which we need to focus in order to get the tobacco control in our desired aim. So with that, I would like to. Yeah, so one more question has actually come, ma'am, about do you provide any training course for students and doctors who want to work for the SLT cessation? So,
yes.
So thanks a lot. We are very soon launch a training program on smokeless tobacco cessation, particularly to the clinicians and those who are into the tobacco control effort. So just stay tuned to our website, and at the same time we'll use your emails to actually circulate this call, and you could actually join those training programs. Thank you so much. So coming to next, now I would actually like to request Ms. Sanchita Roy Pradhan to actually give a vote of thanks. Thank you.
Good afternoon, all. I feel honored and privileged to get the opportunity to propose a vote of thanks on this special occasion. On behalf of the entire team of WHO FCTC Knowledge Hub on Smokeless Tobacco, I express my gratitude to all the participants for their presence and contribution to make this inaugural webinar of TOCOIndia a great success. A special thanks to our respected Director, Dr. Shalini Singh, and Dr. Prashant Kumar Singh, Nodal Officer of WHO FCTC Knowledge Hub on Smokeless Tobacco, and our IT team for providing immense support and making the launch of TOCOIndia, a success. With the launch of TOCOIndia, a monthly online lecture series on tobacco control in India, we have all pledged today towards building a tobacco-free generation. Thank you everyone once again for making it a great success, and we hope to see you all in our upcoming webinars. Thank you.
Thank you. Thank you very much.